why it's so important to stay on particularly an antiplatelet therapy such as Plavix, or if the doctor puts you on anticoagulants such as Xarelto or Eliquis or Coumadin, warfarin, whatever it might be, it's important to stay on it. There's a reason why, and especially I'm going to let you. I was going to explain why doctors put you on Plavix afterwards, but since you're here, you're the doctor. Go ahead and explain, and take the podium on that one.
Yeah, so
Why
most
do you give Plavix?
so the reason why, the standard recommendation based on data is to use what we call dual antiplatelet. What that means is antiplatelet means trying to block those things that form your scabs, those little platelets that clot together. So antiplatelet means trying to give medication that prevents you from forming clot. So that's antiplatelet. Aspirin is one of an antiplatelet agent. And then Plavix, it's got a generic name called clopidogrel because now the patent has run out, so they can't charge you exorbitant money. Now it's generic also. That's another antiplatelet agent. So the standard therapy is dual, meaning two antiplatelet therapy for patients with peripheral arterial disease because you are at a higher risk of clotting your arteries, especially if you've had any interventions or surgeries. Because now once we touch your vessels with a wire, a balloon, a surgery, a bypass, that inflammation that your body responds with sometimes causes you to close down faster. So we put you on antiplatelet therapy to try to prevent your blood from clotting. Now, some people are put on anticoagulation. That's a little different. Anticoagulation, such as Coumadin, Xarelto, Eliquis, but all these other things, they're a different form. It's a different term, but what they do is they work with your cascade of your body that causes clotting. It's a different mechanism than Plavix and aspirin. So some people will be put on Coumadin or other agents that thin the blood more. Um, so that's that. So historically, patients with PAD, we put them on aspirin, baby aspirin, which is 81, plus Plavix. Now, the data most recently in the last 3 years from cardiology studies and literature of like 10,000 patients, they found that for patients with PAD and also risk factors for heart attacks and strokes, they actually did better with baby aspirin and Xarelto, which is the other agent I was talking about. That's from studies called Compass and Voyager. They're very large patient populations. And what they found was by using Xarelto and aspirin for these patients, they had less chances of having a major amputation, heart attack, or stroke. So a lot of us over the last year or two have been trying to transition or change patients onto Xarelto and aspirin. The one issue is that there's a cost problem sometimes for a lot of patients based on insurance and out of pocket. So that's still one of the battles we face, even though the data says it's good. Unfortunately, insurance and medicine doesn't catch up to data. Janssen, who makes Xarelto, does have a lot of programs to give you discounts and packets and all that stuff. I don't know how well it works for everybody. They make it sound like they can work with anybody, but I think we all know in reality that's not how things work. So currently, if you're a new patient, we'll try to start you on the Xarelto and aspirin. But if you're already on therapy and we can't get you Xarelto, it's still data shows it's good. It's just that if we can switch you, we try to use what the best data is. I know it's a long-winded answer. Um, and then also one thing I'll tell you additionally, Plavix, if we put a stent in you, Plavix still has shown to have better results to help that stent incorporate into your blood vessel within that first month. So in a patient, when I put a stent, I'll try to put them on Plavix for a month and then switch them to Xarelto or stay on the Plavix. So there's a lot of nuances, but there's a reason why we're putting you on any of this because we want to prevent your legs from clotting. That's basically the point. It's a little different than the blood clots you get in your veins called DVT. This is arterial disease that narrows and narrows and narrows. And then when it narrows, it's like the pipes in your house from the water tower to your faucet. If the pipes have debris in there or crud, your faucet's not going to run fast. If at some point that pipe blocks completely, the faucet's not going to run at all. So we're trying to prevent the faucet from not getting any blood flow, which is your toes.